Hello, good afternoon. I don't know what time you are actually watching this video. This is Richard Lori back here again with another episode on my channel. And guys, I'm I'm back again after some time. I don't know, maybe you have missed me on my channel. So today I have a special guest here, and she is a medic. She does some wonderful job out here just in saving lives and making sure that we actually have a good health as we move around this particular place. So she's a founder, right?
Yeah,
Yeah,
founder.
she's a founder of a company and actually an emergency company team. But most of it she'll be telling us about whatever they do and how they go about it, what it entails, and yeah, we'll be able to learn more from her. So, Margaret, welcome to my YouTube channel, and I
Thank
really
you.
appreciate you honoring this invitation. We have planned this for long,
Yeah,
almost
I
I think
know.
it's almost a month, but
Yes.
finally you are here. And I just actually I was very pleased with hearing about whatever you are doing actually. And in fact, doing all these things in the village, it's not something easy. And you personally are best in the city. So
Mm.
you commute every now and then to the village back here. So I think it's something good. But why should I talk for you and yet you are here? So I think you'll be able to tell the viewers whatever you do and do all that. So welcome back. Maybe introduce yourself to us. We know who you are, where you have come from. Yeah, all that.
Mm. So, hi viewers. I'm Margaret Atieno, born and brought up in Siaya County, the founder of Harmony Safety Med Care. I'm managing director. So, I'm emergency medical technician by profession. Mm-hmm.
Mm-hmm.
Yeah.
Emergency medical technician by
I'm
profession.
emergency EMT by
So that's a
profession.
professional
That's
actually.
my profession. So, that's what I'm doing on the ground.
Mm-hmm.
So my organization is, like I said, Harmony Safety Medcare. It's based in Siaya, Sega in Siaya County.
Mm-hmm.
And yeah, it's been like 3 years. It's 3 years old.
3 years.
Yes.
Wow. Why did you choose to have the organization based in the rural areas? Why not in the city? Now that in
Mm.
fact we are dealing with emergency cases,
Yes.
and I'm trying to imagine now in a perspective whereby I'm thinking that it is in major cities and towns where you have maybe accidents happening so much because of the so many vehicles and yeah, actually it's highly populated. But now why in the village?
Okay, can I say I was brought up in the village?
Mm-hmm.
I have the village background
Mm-hmm.
and I've been working in the city. So I like the question.
Yeah,
So that's
sure.
the one challenge we have.
Mm-hmm.
We forgot the people back at home.
Mm-hmm.
We came to the city, forgot our people.
Mm-hmm.
So there is a time I go to, like I say, I like village,
Mm-hmm.
and I saw the challenge they have.
Mm-hmm.
So how I came up with the organization, I went to visit the village, and we attended a burial of a young man who got an accident. He was
Mm-hmm.
involved in the accident. The sad
Oh,
part,
sorry.
he
Yeah.
was only cut on the thigh. He didn't have any other injury,
Mm-hmm.
but then he bled to death
Mm-hmm.
in the scene.
So this young man, may his soul rest in peace. Was the accident? Did the accident happen in the village or it was
It
in a
was in the
city?
village. In
Oh,
the
it was in the
village.
village.
Yes, it was in
Okay.
the village.
Mm.
And another thing is kind of we've forgotten the village that we don't even have, like in my home area.
Yeah, actually,
We
yeah.
don't have many
Sure.
hospitals in the area. We don't have any. No, we don't have, like I'll say, we don't have a structured emergency system. It's
Okay.
not there at all.
Actually, I see the point. I'm trying to imagine. By the I can't really count how many times I've seen ambulances passing in the
In
village.
the yeah,
But in
we
town, you
don't have them.
see almost in a daily
Yes,
basis. But
yes.
actually, in the village,
We forgot
for you
in
to
the
spot an
village.
ambulance, so actually, I don't know. Is it because in people assume that in the village there are no accidents or what is it?
Actually,
So.
we really have so many accidents in the village, especially with the motorcycles.
Mm-hmm.
So many.
Mm-hmm.
But then they are forgotten. They are left to die actually
Mm-hmm.
because no one bothers about them. We don't even bother about our own kids. We
Okay.
concentrated in Nairobi,
Mm-hmm.
in the cities.
Mm-hmm.
That is it. So that's why I got the interest to go back
Mm-hmm.
and work for my community.
Yeah, that was nice. So let me take you back to Harmony Safety Med.
Yes.
How did you come up with the idea of coming up with the as in okay in terms of you wanted to save the lives of the people in the village in terms of accidents and all that,
Yes.
but why Harmony? Like, why did you come up with this passion? Where did you get this passion to start something like that? Yeah,
for
harmony self-made. Maybe like I'm trying to say it like something. It's a big thing because I'm trying to take in a perspective whereby this when trying to do an emergency organization or something like that, you need ambulances.
you need
The
ambulances.
ambulances are things that need fuel. They need you need vehicles. No, not
Yeah,
one,
you have to
maybe
be-
several. Yeah, you
yes.
have to. So maybe what really made you
Okay, I really
decide to do
wanted
that?
to, like 1 year. I save. I believe if I save one life, I
Mhm.
save a whole community.
Mhm.
So I had to do it whether I was financially not very able,
Mhm.
and I just believe, and I'm very sure one day we are going to make it.
Mhm.
For now, we have an office in Sega.
Mhm.
Is
Sega is in Siaya
Sega
County.
in Siaya County,
Okay.
Sega town,
Mhm.
and with a small office with some few equipment. We
Okay.
are not really well equipped,
Mhm.
but we are doing more. For now, we are doing more on first aid, because first aid we don't need much equipment.
Mhm.
But our target, our main aim here is to save a life.
Mhm.
So we've been training people in schools, uh, high school, primary schools, the border team, because border, like I said before, they are the main transporters. They're actually they're the means we use to transport patients there at back at home. But it's a pity, but there's the only people they have on the ground. So after we train them, so that and then most of the time they're the most vulnerable people. They get accidents now and then. So by training them, we believe they can be able to tackle just like minor accidents, as long as someone is one of them is ready to is able to arrest bleeding, is good to go. Just one of
So you train the border
we train the
people,
border
schools. Those are
schools,
both primary, high school,
high school,
colleges.
community.
Okay.
We go to the villages and
Okay.
we train the groups, women groups, all groups in the village.
In terms of how to handle the emergencies.
Yeah. For now, we are mostly concentrating, because we don't have much facility that is. We are much concentrating on first aid.
Okay.
Yeah, for now.
So in terms of sponsorship and all that, how do you manage such? Because I'm trying to see when you're trying to train all these people, maybe it's something that needs finances or something like that, support.
For now,
Like it's not a business.
it's not a business.
It's not. It's just an organization or where it's your passion. Just want
It's
to,
a
to
passion.
train people.
Yeah.
Yeah. So where do you get the finances? Because I'm trying to imagine moving from one school to another, arranging all those people,
Actually, it's a
and
lot of,
there are people whom you are not working alone,
yes.
and there are people who need to feed themselves. So and you're not in business, like
Yeah, I'm not in
so.
business.
What is it? Tell us how do you manage all this?
Currently, it's purely voluntarily.
Okay.
I just volunteer to pay right now I have one person on the ground,
Okay.
but I just sacrifice to give him some small amount just to help me make sure he helped me on the, especially when I'm here. I can just send him, please go to this school. They need some training. So for now, mostly I'm just volunteering from my pocket for now.
Wow. So far, maybe you have how many trainings have you been able to carry out?
About, I say for now, about 12 schools,
Okay.
including the School of the Deaf. Community for women group, I've done 4 in the village. Border group, I've done 6. Yeah, 6. So around 500 people. Yes.
So this border group, border, they're funny people. Like, how do you manage to convince them that instead of them going to the stage, they come and maybe learn some few skills? Because I see most of them. Okay, how unless you give them a token or something? Because I'm trying to imagine.
Actually, it's not been easy.
Yeah.
They don't see it from the point
Yeah,
I
because
see it.
for students, you just go to the school, you talk to the school management, then
They
you can be able
understand.
to organize a day or so
Yes.
and timings. And but for border people, that they should be at work.
They should be at
Yeah.
work.
So and most of them, they rely on that as their main source of income and all that. So trying to convince him or her first that he or she needs to come for the training and leave the customer.
It's not easy.
How do you manage that?
So normally I go to their team leader.
Okay.
And then I tell them, like, tomorrow by 4 I'll be there. So he can ask. They ask their team people to come. The members. But it's not easy because after the training, the question is always, are you paying us? Okay, they're normally used to the politicians' money.
Yeah.
They are used to the cash out. So you train them for free.
The handouts.
The handouts. So you train them for free just because of what you are seeing, which you are not seeing. By the end of the day, they want money. And I just like, I tell them, no, it's going to help you, it's not me. So some of them, I've never been happy about it, but I'll have to do. I just have to do it.
I really feel that that was actually the best idea for the village, because the border people, they're just for them, some of them I don't know if there's, but I think most of them, they just train how to ride these borders or these motorbikes in the village. One day, the second day, this person is having a customer on the motorbike to make money. So we will find that maybe most of them, they don't go through this maybe just the serious training about the traffic rules and all that. Even some of them don't even have the license,
Mostly.
insurance.
Bigger percentage.
And so then coming up with the idea of training them, because they're the same people who are operating in the villages actually.
Yes.
So when they're doing all these their day-to-day activities, they get accidents maybe somewhere, even if so too far from a health facility. So I think maybe equipping them with this knowledge about how to give some first aid to themselves and maybe to their customers, or maybe to someone else in the village, I think something very important. Because these are the people who are penetrating through those villages where they are not. I'm trying to imagine, like, you have an accident in somewhere, like a hospital is almost 5 kilometers away, and you are the only one there. You are actually they need even to be given maybe some first aid kits also.
So yeah.
Just for some few 1 to 3 to run about that. Anyway, let's come back to the Harmony Safety Med. Maybe how many staffs do you have? You have mentioned about one staff. Is he or she the only one, or you have some other people whom maybe you incorporate in when it comes to you want to train a bigger number
for
of people?
now, it's just that one person. But by June, we are hoping to have about 5. Because June we are going to open our office officially.
Okay.
And we'll start training in our own institution. For now, we've been going to schools. We've been visiting schools. And we are hoping, if all goes well, we get an ambulance. Because for now, we have borders ambulances in the area.
Oh, so we have not just have border ambulance.
Not border. Okay, they're the people operating. Like, they are the only people we can send. They can send to pick the patients.
Wait, so you have a border who can operate like an ambulance, in short, like he or she can be sent somewhere where there's an incident or something like that.
The few that we trained, they are those few ones.
Yeah. So you are talking about you talked about border ambulances.
Yes.
So there are people whom you have trained.
Yes, we trained them
and you have equipped them with the first aid equipment, or they
first
have
aid
the kits.
The kits and the gloves, enough gloves.
Okay.
Yeah.
So how do they get the communication? Is it from the site or from the organization itself? Maybe from your headquarter. Like there's an accident or something that needs to be that needs attention, and he or she needs to go there. Like, you are the ones whom you call them. Maybe you need to rush to.
No, the person we have on the ground for now, he's based in Sega.
Okay.
So this number, like, normally when we go to do health talk in the community, we go to the barazas, churches, we share the number. Okay. So for the people who know the number, they just call the person on the ground now, and then the ambulance team, they are activated, they go for the patient.
Yeah,
for now.
That's
but the challenge, the hospitals are so few.
That's what I'm trying to think about.
Yeah,
like
so few in the area.
Maybe if you can estimate on which area coverage do you cover, like is it the entire county? Is it just maybe a community, or is it a sub county, or the entire Siaya county, or is it around Sega? Sorry, is it around Sega? Just around Sega, or?
No, we are in bigger part of Siaya County. Okay. Bigger part, but we are aiming to go beyond. That's our
in terms of trainings.
Okay, training, the emergencies, the system, working on the emergency system.
Okay.
We are introducing firefighting.
Okay.
And like I said, soon we are hoping to have ambulances, because like the truth is, in my county, I think we have just a referral,
Yeah.
but we go as far as Eldoret. And remember, someone is sick, referral to Siaya. We don't have ambulance, like no equipped ambulance, no medical, no, what do you call it? A structured system. And we have very few hospitals in the area. Actually, there are very few. Like if I say my side, in a Sega area, it's a bigger part that we don't even have an X-ray machine. So we need to go to Siaya or Busia.
Sega area, like
Sega, it's Sega location. It's a big area. Big.
So in case you get someone maybe who needs such an
services,
they're not
readily available. We are referred to Siaya or Busia. It's quite a distance.
That's quite a distance. Just for an X-ray.
An X-ray. Normally, okay, this one in Gunja, it's a private one, but most of the times it's not working. Okay. So you have to go to Busia. Major referrals is in Eldoret referral.
So according to you, how can you describe maybe the healthcare in terms of how well equipped they are in that area, Sega area? How is it? Is it?
It's forgotten.
It's forgotten.
We're forgotten.
So
it's so poor.
Very poor. It needs like I think I'm really pleased with the idea of coming up with such an activity. More so targeting the rural people, but also I'm also trying to see you are based in the city, right?
No. Okay, for now, but soon I'm moving. Like I said, soon I'm moving to the area. Okay. Now to work there fully. But for now, I have to. I said we don't have finances for now. Okay. So I have to get to work, get some cash. It's when
I can say I can learn like there are so many challenges in this. Maybe if you can just be able to mention what are the main challenges that you guys are going through trying to provide all these services in terms of emergency healthcare. You want to do it free. You have the passion. It is far. You don't have the vehicles. You don't have like majorly. Just tell us about the challenges. Which challenges are you getting on this in this when going about your work?
Okay, first is financial constraint. Okay. That's why now I have to be firm. Actually, I should not be here, but I have to get some cash. Okay. To go and move forward for the organization to move. And then, like I said, my border guys, you train them and then they want cash out.
So you pay them after training them?
They want to get paid. And sometimes they can turn to be rowdy. Yeah. And another
or sometimes even you are training him, then he sees a customer. You want to
yeah. So they leave you training them. They don't see the importance. Some of them don't see the importance of it. So movement.
So about infrastructure,
the infrastructure, yeah. Though we have the office, but we need a bigger. Okay, we have land, we have the offices, but we need a bigger building for classes, enough for classes. Yeah, and in future we are hoping to have a trauma hospital, and that one we need a lot for now.
Then also in the same area, do you have hospitals whom you are directly linked to? Like in case there's an emergency or so and so, maybe when you are ambulances, let me use this simple words. When you you dispatch an ambulance into the to the area or the scene, then he picks this patient. Do you have a specific place whereby like they don't have to go there, then wanaanza ile kuulizwa tena they need to pay, like do you have just facilities whom you are linked directly, like you pick this, they take them there, they just take care of that person without having to ask this person to pay, or that they don't like, it's like they don't know this person and where he or she has come from?
We are working on it, but it has been a challenge because what they ask for is money first. It has been a challenge. And that's another challenge we have because sometimes our people, they pick someone on the
I'm trying to imagine you just pick someone on the road, then you take them to a hospital.
It has been a challenge because sometimes they're demanded to pay for the deposit. Remember, this person, they don't even know him. And then in the area, policemen, if you have maybe an accident case, the policemen, they take a lot of time to respond. And then someone is bleeding. So the only thing you can do is to pick the person to the hospital's facility. So remember, you've removed the person from the scene. And then if you don't know the person, sometimes they complicate us in the
So if I may ask, maybe throughout your practice and so far for all those days that have all those years, you have said about 3 years, maybe can you just point to one main incident whereby you feel like you did well in terms okay, leave alone the training, like in terms of there's something, maybe there was an accident or something which you can just pick and you feel like this one we did well, like if we could not have maybe intervened, then the case could have been worse. So you do have just a specific case, like whom as an organization you feel like, yeah, this one we made it and we are happy for this.
That one was in school.
Okay.
When a student, he fell down, they didn't know what was happening. But from the training we had before,
okay,
it was an asthmatic student.
Yeah.
So at least they were able to tell. They did first aid and they rescued the child.
Yeah, so things like so just having an inhaler or something like that, yes. Yeah, for asthmatic actually. So that these just simple ideas, yes. Which yeah, I think that was nice. And what's the biggest challenge you have come across when doing this throughout when doing your work, the biggest challenge you have come across? And maybe I'm assuming like for instance you had a case, yes. Then you wanted to help this person, then there was a big obstacle that one really maybe could have just blown you away and said ikaza ama acha ikae. Do you have any
for
maybe?
Now, no. For now, no.
I'm trying to imagine maybe you get a client just on the road, yes. Yeah, a patient on the road, then you rush them to a hospital, then you are being told that the person needs to pay maybe cash before being given the service. Then unfortunately maybe the situation gets worse, so for you are trying to help, but now there's someone else whom haoni hiyo kama usaidizi, like to him or her anafikiria about pesa kwanza. Where do you see yourself in the next 5 years?
Okay, in the next 5 years, we want to see ourselves grown countrywide and perhaps out of the country. And we want to see a safe country. We want to work on the challenges that we've been having. If we can work on the policy in Kenya, such that if you get somebody, you meet an injured stranger on the road or anywhere, you take to the hospital, you are not captured to pay the bills, because this one is scaring people from saving others, saving strangers. Sometimes you are even held accountable for, especially if it's an incident of crime. You don't know the person, you're just trying to help.
Yeah, actually, I think on the same, I even remember actually someone telling me about in case you are driving on the road, yes. Then you meet someone who has been hit by maybe a vehicle, that's the hit and run. So someone was telling me about, like, if you help that person, maybe take him or her to the nearest health facility, the hospital will always hold you, yeah. Like unless you produce whoever did all this. So you'll find that most of the cars they just pass in case because to avoid so many issues, and you're not the one, if you get such an incident, they don't stop actually, which I think is something not really nice.
I think it should be put in a policy.
Yeah.
And maybe if the government can put aside some finance for that.
I think the government is listening. I think the government is listening about that.
Because if it were you, this thing happened, it can get anybody. And then recently you have cases of mass incidents accident here and there, and we find like every day 10 to 40. It has been crazy, crazy crisis of late. So you can imagine the accident has happened, a bus, and then they say 10 people dead, 40. And I'm imagining, as a medic, I don't see how possible it is for a number of 40 people to die in a span of 40 of 1 2 hours. Because normally you go to the scene, already these people are covered with the bed sheets, a piece of cloth. So they are assumed dead. So who certified these deaths? Just the lay people, the layman who doesn't have the professional background.
I think we need to know that
certifying
who certifies these deaths.
this death on the ground, because you come already 7 people are covered. Who certified these deaths? And these are the lay people. So the next thing are they're carried to the morgue. So I have a feeling that some of these people are taken to the morgue alive, because if it was a drowning case, that's a bit different. Someone is decapitated on the head, it's a bit different. But within 2 hours, a span of 2 hours, 40 people dying, I don't see it possible.
Then another question about we have been having floods of late in our country.
Yes.
Like I think in the last few weeks or so. Maybe have you also trained these people in terms of how to the safety measures and first aid in terms of flooding and all that?
Yes.
What they need to do?
Yeah, we were lucky for us. It has not reached the place, but we prepared our team.
Okay.
We have prepared our people, so they are ready for anything. Yeah.
Yeah, I think that's good actually to hear from you. Then I heard you are talking about moving out of the country. Hope you are not moving out of the country. Maybe you are running from us.
No.
Like
No,
it is expanding your territories.
Yeah, we are expanding our territory.
That would be nice. Maybe then from there, anything else? Maybe we want us to talk about in terms of the emergencies and all that, which we have not talked about.
We are just urging the government to consider emergency department. It's a forgotten department in Kenya. Yet people are dying. Cases of accident, we never know who is going to rescue us. Maybe this team you are neglecting is the team coming to rescue you.
I think you talk to the government using that camera. Talk to the government directly using the camera.
So we're urging the government, if they can just listen to us and do something on emergency department. It's a forgotten department, yet very important one. Yeah, that's all.
So thank you so much, Margaret, for your time, and you have really done well. I know it has been quite a long time looking for you. Maybe you just tell us about it, because when I heard it on social media and I saw all that about what you do as your work, I really felt being a medic also. I felt like it was a very good idea. Mostly trying not to concentrate on in the village. It was something very nice, and it will impact a lot of work.
I'm just back to the village.
We are there. Actually, I'm supporting this. I'm supporting this fully, and I hope you will get some people, sponsors, and maybe well wishers to help you in the how to be able to run all these trainings and all that. I know it's not something easy, but yeah, things will be good. Yeah, we usually say if it's not you, then who else will do it? If you quit, whom do you want to? Yeah? If you are saying you are quitting this, then who will do it? Yeah, so you are the only one who will be able to help us this. But I really appreciate for your time, and hope to see you soon for more. And in case you have any other things you want just to share with us, maybe in terms of trainings and all that and what you do, maybe basic trainings, we are also open through our channel, can be able to reach your people. And guys, make sure you subscribe to this so that we'll be able to get some more of these videos, because now we wanted to deal basically on some few things, including medical perspectives, how she'll be helping us about things to do with emergencies and what to expect, and maybe what to do when you have been when you're in a crisis in terms of that needs some urgent medical attention. But I hope you guys will be able to subscribe to this channel, and will watch this video to the end. You'll share it to your friends, families, and all that. Then if you know of someone, or you yourself can be able to come in, chip in, and help our sister Margaret here in whatever she's doing, being a wonderful job, she'll really appreciate that. And I also know the community will all appreciate, and yeah, blessings will follow. Otherwise, thank you so much, and bye bye. See you next time.